Hello everybody. So today I know you all are excited on what we are going to see. Yes. Before going into it, let us see what case we are going to deal with it. So today the case scenario is that we have Mr. Arjun with us along with his attendant, his daughter. So they have come with the chief complaints of like giddiness and frequency of urination and polyphagia, which is excessive intake of food, and like binge eating, and as well excessive sweating. So after coming to the hospital, where he had a screening test of such as random blood sugar, FBS, fasting blood sugar, PPBS, postprandial blood sugar, and also the HbA1c, which is glycosylated hemoglobin, in which he had a very bad control, and hence the endocrinologists have planned for starting with insulin therapy. So today we are going to see about insulin administration and how a nurse should do and what are the things not to be done in an insulin administration. So the session will be preceded by Ms. Neha Thomas, who will be giving the introduction of what is insulin administration. Over to you, session.
Hello everybody. Insulin is administered to manage the blood sugar levels for diabetes patients, especially type 1 and type 2 diabetes. This is also used for gestational diabetes and to prevent the complications occur due to diabetes. Insulin is used to manage the blood sugar level either when the body cannot produce insulin or when the body cannot respond to the insulin produced by the body.
Thank you. Very good introduction of what is insulin administration. And now over to the sequence, that is, before you start the insulin administration, we being the nurse, we have to know what are the articles. So the articles will be presided by Teresa. Over to you, Teresa.
Start.
First, we need to set a tray for insulin administration. So, a clean tray containing injection tray with loaded insulin. Then cotton with a bowl containing cotton. Injection human attrapid vial and a kidney tray. Then for documentation, medication card and pen is also present.
So in this one small correction is that we can have the spirit swabs for decontamination of the skin. So this is spirit swab, and here is like after you load the drug and when you are going to administer to the patient, you can use this sterile container, which is the injection administration tray. Yes, she will be telling the difference between what is normal syringe and the difference between the insulin syringe. Let us see in detail a little closer.
In normal syringe, it is given in ml, whereas in insulin syringe, it is given in units. So, when compared to ml, we cannot directly given load medications through this normal syringe. We can only directly administer insulin through this insulin syringe.
And Teresa, can you please explain the parts of the insulin syringe for us?
This is the protective cap, this is the needle, this is the needle hub, this is gasket. This is also a protective cap, then plunger, volume markings, barrel.
Yeah, I know you're a little shivering. So again, I would repeat this point. That is, you have two protective caps. One is on the needle side and the other protective cap on the plunger side, right? And see, you nurses, pretty young nurses, there is chances for needle stick injury. So what we advise is that never do the double hand technique. Always try to use the single hand technique. And very close to the protective cap, you have the small needle which is only going to penetrate to the subcutaneous layer. Followed by that, the small very closed end is the, we call it as the needle hub, and then the black portion which is shown over here is your mainly what we call it as like the black portion,
Gasket.
gaskets, yeah. And then you have the plunger, which is like you can load the volume how much ever the doctor has ordered, and you can administer to the patient. And keep in mind, this is always being expressed in units. And the other thing, that is, this is the barrel and you have the piston. Always use single hand technique to avoid needle stick injuries. Yes. Thank you, Teresa. That was a good explanation. Yeah.
What are the sites we can administer?
Yes, Santosh.
Yes, Santosh, I will help you to find out the sites to administer the insulin. The most common site is abdomen. We can administer 2 inches or 5 centimeter in the abdomen, and the next site is thigh. The front side or back of the thigh is perfect for the administration of insulin, and the third site is upper arm. The upper arm is most common site. Back of the upper arm is mostly we select for the administration of insulin, and the fourth site is upper buttocks, but it is harder to find out the proper site.
Thank you.
Why in the buttocks it is too harder is that the subcutaneous layer is very minimum and compared. There you have the intramuscular layer very large amount. So better always what we advise is that you can approach for the deltoid side, which is on the upper arm. Thank you so much, Amma, for this good explanation.
How can we upload the insulin?
Yeah, that's a good question. The insulin techniques, how to upload and all will be decided by our next student nurse, which is Mrs. Harini. Over to you.
Check the patient name, age and IP number in the patient ID tag. Check rights of drug administrations are right patient, right drug, right time, right dose, right route, right education and documentation.
So yes. So further I could give some more points like never go near the patient like a robotics. Always have a happy smiling face on you, and introduce yourself. Like say that yes, I am Mrs.Brammu. I am going to be your nurse. I am going to administer this drug. And what are the side effects of this drug? What are the major uses of this drug? So you can educate the patient whereby there will be a good interaction. The nurse-patient interaction will be very much effective, where the patient also have a trustworthy with us, and they will be going further for the treatment. So always keep in mind before procedure, during procedure and after procedure. So we being the nurses in before procedure, you are going to see the right patient. So the common thing is that always check the patient ID tag with the patient file. So if the patient file is very close to you, you can open and just check whether it is Mr. Arjun and 40 years, yes, and what is the diagnosis and what is the IP number 32645 and 32645, yes, he is the right patient. In case if the patient is unconscious, then you cannot ask him by his name. So the attender will be by the side. In case if the attender is not there, the universal rule, the patient name and the IP number and the OP number. And after this is done, after you have checked, you have to also have the doctor's order. So if the doctor's order is there, then you can proceed with it. If there is no order, you cannot give the drug. And then after that, you are going to check for the right drug, whether you have prepared the same drug, whether you have diluted in the same constituent. All that should be checked before you administer. And the fourth important principle what we have to keep in mind, provide privacy. So you can ask a courtesy, like if he or she is not willing to have anyone nearby. Like maybe you are choosing a thigh. If it is a deltoid, it's not going to be a stigma. If you are going to use the abdomen or thigh, you can request the attendant to please wait out, and then you can give the drug administration. Now are you clear with it? Yeah.
How can we load the
So the loading will be given about all those details will be decided by our student nurse, Ms. Atila. Over to you, Atila.
Firstly, we need to explain the procedure to the patient and take the articles to the bedside and provide privacy for the patient. First, we need to take the vial. First procedure, before touching the vial, and take the vial, decontaminate the opening of the vial using cotton.
So can I interrupt over here, Atila? Yes. So this being a multi-dose vial, the this is the extra point what you have to keep in mind is that this is a multi-dose vial. Multi-dose vial means don't confuse. This can be used for n number of patients in the same particular ward. Because of the cost efficacy, we are going to share the drug. Or some patients in deluxe ward will be having uniquely for themselves. So if it is a multi-dose vial, it will be dated with the date of opening as we have dated over here. So date of opening. And before you are going to take the medicine, always do the half decontamination by using circular techniques onto the cork. And this is nothing but you are just removing the microorganisms which has been settled over the cork region. Right? Now are you clear like why we do this procedure? Over to you.
Next, we need to take the insulin needle and take off the cap and take the vial and place it upside down and insert the needle and load according to the doctor's prescribed order of insulin units. And before administering insulin to patient, we need to again perform hand rub procedure and make the site clear for the insulin administration. And first
Use the alcohol swab.
we need to use the alcohol swab and first we need to aspirate the needle and then only we need to administer the insulin medication. After administering insulin medication, we should not,
But we have to just ask the patient to hold with the other arm. He can hold it over here, or the attender can hold it for 1 second, or we ourselves can hold it for 1 second. Thank you.
Why we cannot rub like other iron medication?
Yeah, that's a good question, Santosh. Here we should not do vigorous rubbing because when you do the vigorous rubbing, the solution will be dissolving very fast. That is, the insulin human attrapant will be moving fast. These molecules will enter into the intramuscular layer, and then the action will be very spontaneous. As we have different types of insulin, and if you are going to give a rapid insulin, this may create a sudden hypoglycemic episode to the patient, and patient may collapse. That's the reason we are not rubbing the site.
Whether any preparations before insulin?
Yeah, there are some quite preparations that will be decided by our main student nurse, Mr. Srivar.
So there is no preparation, but you have to check doctor's order, prescription and the medication.
Thank you.
So you are clear with that?
Yes.
Any more doubts you have?
There is any side effect now?
Yeah, there are quite side effects over there. That will be decided by our student nurse, Nitya.
There are immediate and late side effects. Immediate side effects are hypoglycemia and allergic reaction. Late side effects is cardiac arrest and lipo.
So the immediate side effects, as she told us, like patient will be having going for hypoglycemic episode, where it can go for coma. Patient can go for permanent comatose state. The other one is that prolonged, when you go on prick onto the particular site. Might be this patient is at the age of now 40. If he is going to be till 45 years, 5 years of continuous insulin administration, where there can be causing dystrophy of the subcutaneous layer, which we call it as lipodystrophy. Right? Any other further doubts you have it? Yeah. So to conclude,
After doing insulin administration in this way, we will be able to control diabetes, especially for insulin dependent patients. Thank you.
yeah, the last point is that how we are going to segregate these waste. Can anyone come forward to tell about the segregation of waste, biomedical waste?
After the insulin administration,
So this is the aftercare.
after insulin administration, the syringe will be put up on the white
Punch-proof container.
and
Yeah.
avoid needle stick injury and avoid to recap the needle and
The
used cotton balls are put in the red yellow dustbin and rearrange the tray and get up into the.
And one more point is the close monitoring of the patient, whether the patient had the drug on the right time, as well as whether the food was received within the stipulated time frame. By must be after administration of insulin. Within 15 minutes, the patient should consume his meal. See that the meal is ready and then give the insulin administration to avoid the unexpected events. So you can also educate the patient attender also regarding the side effects of what are the possible side effects, and that way we can early prevent the major complication. Thank you for your patient listening. Don't forget to like, subscribe and comment my channel, and I also thank my whole team. Please comment, sir. Thank you all. Bye-bye.